Delaware County is blessed to have many advocates and champions of maternal health, some of whom are joining us here today. I'd like to acknowledge them and the work they do each day to ensure that women, especially Black and brown women, have access to quality maternal health care. Thank you to the local panelists, Shauna Williams, founder of SW Doula, Stephanie Reese, administrator for Division of Personal Health at Delaware County Health Department, Lisa Brown, MD, Axia Women's Health, and Carolina Alshon, Social Services Coordinator at the Foundation of Delaware County. And thank you to tonight's moderator, Diversity and Inclusion Officer for Delaware County Community College, Sami Myers. And thank you to Shawnee Gibson-Benton and Amari Maynard from the film, who experienced devastating personal losses in their family due to childbirth. Their stories will help those of you attending today better understand the historical and current issues related to Black maternal morbidity and mortality and the impact on the Black community.
So we're going to go into questions about the film. So oftentimes when people are exposed to stories like the film has shared with us today, or presented with this type of information about inequity in any of our systems, we are met with the familiar question of, it's 2023, how is this happening in our country? And this is especially true when thinking of medicine, as we are often taught, as was expressed in the video, that the United States really has the best options for treatment. The film made it clear that unequal treatment, especially for Black women, has a long history in our medical system. So can we start with a brief discussion about how the United States healthcare system has been a historically difficult place for people of color, and especially Black people, to navigate and feel safe?
Was this aspect that's covered in the film about the medicalization of birth and how that impacted the way families gave birth, and particularly the way that it impacted Black families in this country. This view of the doctor as the expert, and I think it's so striking when Shawnee had done reproductive justice work, said, okay, well, the doctor, you're the expert. You're saying everything's okay. I'm going to believe you. And that is what we're taught. The doctor is the expert. And that takes away from our individual and generational wisdom.
When we look at it as a whole, and we're seeing these mortality rates in Black women, who are we holding accountable for that? Insurance companies, how do they play a role in this? The hospitals, medical providers, how do we hold them accountable?
I'd like to add something. Maybe this is a little bit too radical, but it seems to me that now is the new master is the insurance companies. They are the ones that dictate care for everyone. How long a doctor is going to be with the patient, what kind of care the patient is going to receive. For the moms that we serve, one of my main concerns in our group is that a mom goes to the 6-week checkup and postpartum, and she expresses that she's feeling perhaps anxiety, experiencing what could be symptoms of anxiety. There are times when the OBGYN immediately prescribes something, a benzodiazepine, for a mom who might only need support or might need to be referred to one of the community services that are available. So this prescription is provided without any kind of education. So to me, it's like, what are we doing? So mom then feels strange. Mom then feels detached. There's there's the lack of education. And it's this kind of like, okay, let's give a prescription to mom and see what happens.
I've also noticed that, again, that concept, and Dr. Monica Lamour talks about, to really eradicate Black maternal mortality, we first have to stop blaming Black women. There is not enough acknowledgement on medical providers' part. And I find it very frustrating, and I've been in situations where I've been called to do trainings, and one in particular was with doctors across the state of Pennsylvania. And my white colleagues went in first to do the initial part of the training and got such furious pushback because they were talking about anti-bias and structural racism and were called such horrible names that they were like, we don't even feel safe to let y'all do y'all part. We can't even do that to y'all. And I said, that's the doctors across our state, right? And so how can I talk about trust if that's what our families are working with?
Yes, I agree with you 100%. Education, advocate for yourself, find community resources, and have somebody who can be there for you. In my case, I can advocate for everybody, but when it comes to me, I don't do a really good job. So if something serious is going on, then my husband is gonna be there with me. So for immigrants, moms, they don't have their family here. They don't have perhaps a partner, or their partner must be working, because if the partner doesn't work, there is not food on the table. So being able to create community for us, so organizations like the Foundation for Delaware County. So
My advice has always been advocate, advocate, advocate for yourself, no matter what the medical condition is. You can't stay silent.
At the Foundation, we're committed to shining a light on these big issues facing our county and to coordinating the philanthropic effort to address them. We believe social and economic inequalities and concerns do not exist in silos. The Black maternal rate for 2015 to 2019 was 22 deaths per 100,000 live births. This far exceeds the Healthy People 2020 goal of 11.4 deaths per 100,000 live births. The statistics are not just numbers, they're people. They're our mothers and our daughters, our aunts, our friends, our cousins. They're our neighbors, levels. So I urge you to do what you can in terms of raising your voice, using your vote. Keep an eye on local, state, and federal legislative efforts, and urge your elected officials to support these important policy opportunities that support healthy maternal and birth outcomes. They support birthing people and families. I thank you so much for being here this evening. I thank you for your interest and engagement with this incredibly important issue.
Certainly I'm going to continue to advocate for myself and just try to create a safe space in my community. I come from a child care background, and I have most of my experience with the fourth trimester, the postpartum period, but just diving more into creating a safe space and just hearing and seeing birthing people.
So as a registered nurse, the one thing I learned from that experience is listen to the mom. Listen to what they're telling you. Their bodies know what's going on. They know what's going on. They may not be able to articulate it well, but when they're telling you something's wrong, as a nurse, it's my job to advocate for my patient to the doctors to ensure that they receive the proper care and they're heard by the doctor. So listening is key with everything that I do in my role as the administrator, but more so as a nurse. So I come into my job every day as a registered nurse because I want to make sure that we're providing safety, patient care, and to make sure that we're hearing what our patients' needs are. Sometimes they don't even know what the needs are, and I want to be able to help them work through that, process it. Sometimes there's a language barrier. We do have things in place and resources in place to be able to work through those barriers, such as language lines and things like that. But absolutely, I come in as a nurse first, and I listen to everyone that comes in.
So we have hosted Aftershock now 2 times in the Delaware County community, really in partnership with our collaborative CAN partners, our Community Action Network partners. So part of my role has been strategic partnerships and convening stakeholders around issues that are really important. And I don't think there's anything more important for those of us working with pregnant families in Delaware County other than really working to improve the system of care and build that village of support that families need so much. It's a beautiful film and it's a powerful film, and I don't think people can watch that film without feeling moved to do something to try and improve outcomes and to make life better for families who are struggling or families who are pregnant and not receiving adequate care. I think the importance of getting the word out is that it mobilizes action, and that's really what we need in Delaware County. We need to, as Bruce Maxwell says in the film, we really need to imagine new systems of care. So think creatively about what those opportunities are, and think about ways we could do things differently than maybe they've always been done in our